Okay, Assalamualaikum and hi. My name is SYAZWINA from Group 1. So today my group and I will discuss in detail about coding method in certain condition originating in the perinatal period, which is chapter 16. So first, what is perinatal period? So perinatal period is referred to the time before and after the birth of a child. So based on KKM, perinatal period is time range between 28 weeks of pregnancy until 4 weeks after giving birth, which is the first 28 days after birth. So anything that happened at this period, especially to the newborn, will have its own code, and codes for perinatal range is from P00 to P96. So now I will explain in details about the general rules in coding this topic. So first, before we go into more detail, we should remember that this code, which is P00 to P96, should not be used in maternal records. And as long as the patient still has the illness or the same condition, the code for chapter 16 will be carried up every time they perform checkup at the healthcare centers for the rest of their life. So next, we will go into the birth record, which is referring to code Z38. So about this code, it should be remembered that this code can only be used for record the babies only, and not in the mother's record. When making the newborn record, the PD must use Z38, which is according to their place of birth and type of delivery. For example, Z38.01 for single infant that delivered for cesarean. But just in case that the baby is transferred to another health facility, code Z38 is no longer used in the new hospital. So next, if another chapter has more specific details about the condition that we are looking for, we are allowed to use the code from that other chapter, and for unspecified diagnosis, we can take the code from the sign and symptoms that faced by the patient.
Assalamualaikum, my name is AZREEN IZZATI, and I will continue to the next part. Birth process and community acquired conditions. So, in this condition, if a newborn has a condition that may be either due to the birth process or community acquired, and the documentation is unidentified or it does not indicate which is it, then by default it is due to the birth process, and the codes from chapter 16 should be used. But if the case is confirmed community acquired, then the code from chapter 16 should not be assigned. The next part is on observation and evaluation of newborns for suspected condition not found. Okay, the first one is the use of Z05 codes. Z05 is observation and evaluation of newborns and infants for suspected condition ruled out. Okay, this category is to be used for the newborns within their neonatal period, the first 28 days of their life, who are suspected of having an abnormal condition but without signs or symptoms, and which after examination and evaluation is ruled out. But if the patient has identified signs or symptoms, the code from Z05 should not be used. The next one is Z05 on other than the birth record. Z05 may be also assigned as a PD for a counter when the code from category Z38 code is no longer applies. So the code from category Z05 are used for only a healthy newborns and infants for which no condition after the study is found to be present. The next one is Z05 on the birth record. So the code from category Z05 is to be used as the secondary code or SD after the code from category Z38, the live-born infants, according to the place of birth and the type of delivery.
Hello everyone, my name is FRANSESCA Albert, and today I'm going to present the chapter 16 of medical coding, which is perinatal. For coding additional perinatal diagnosis, assigning codes for conditions that require treatment, which means you have to assign code only when the patient needs a treatment, and assign code for the patient that has to be treated further due. Furthermore, The code also should only be assigned when the investigation is being prolonged and when the patient needs to stay longer in the hospital. And also they need any medical supplies to be used for them. Next is the code for conditions specified as having implications for future healthcare needs. Codes should be assigned when the doctor has explained when it has been specified by the provider to make sure there will be a reference as an implications for their health need in the future. Furthermore, for the prematurity and fetal growth retardation, the provider will use a different criteria for premature, and code should not be assigned for the premature cause unless it was given by the provider. Also, the code should be assigned as P05, which is disorders of newborn related to slow fetal growth and fetal malnutrition. Also, code P07 should be assigned for disorders of newborn related to short gestation and low birth weight, where they shall not be elsewhere classified, and it should be coded according to the newborn weight that is recorded during pregnancy. However, if both weight and fetal age are available during birth, two codes from P07 should be used with the sequence of code during the birth assigned.
Hi, I am AMIRA ANUAR, and I will continue the guideline, which is low birth weight and immaturity status. This guideline is assigned with a code of category P07. This is a disorders of a newborn that related to short gestation and also low birth weight, and it not elsewhere specified. This is used for a child or adult who are premature or had a low birth weight as a newborn, and this is actually affecting the patient current health status. And when both weight and gestational age of newborn are available in a case study, they both should be coded with the birth weight sequence with the before the gestational age. Next is bacterial sepsis of newborn, and this guideline is coded from category P36. If a perinatal is documented as having sepsis without any documentation or congenital and community acquired, it should be assigned as P36. And P36 code is also include the casual organism. We also need to add an additional code from category B95, which is Streptococcus, Staphylococcus, and Enterococcus, which is as the cause of disease classified in elsewhere. And if the P36 code are not include the casual organism, we should assign an additional code from category B96. And if is it applicable, we need to use additional codes to identify the severe sepsis, which is R56 on 2 additional, and any associated with the acute organ dysfunction.
Stillbirth. For stillbirth, we should assign code P95, and this code will only be used in that institution to maintain the separate of the records for stillbirth. And the most important thing is, code P95 should not be assigned for mother's record. The last one is COVID-19 infection in newborn. If the newborn was test positive for COVID-19, we should assign code U07.1. Meanwhile, if the newborn was test positive for COVID-19 and the provider documents the condition was contracted in utero or during birth process, we should assign code from P35.8 and also U07.1. But when it comes to newborn records, code Z38 would be remain as the principal diagnosis.
This is one of the case study that related to certain condition originating in the perinatal period, P00-P96. This 12 days old infant present to the office today with numerous pustules that have a yellow cast over the lesions, and the lesions are on the infant face and hence consistent with neonatal pyoderma. Doctor instructed that the mother to bath the child twice a day and to apply an antibiotic ointment. If the skin does not clear within 1 week, they should return to the office or to the clinic. So, this 12 days infant present some curls on his face and also hand, and he is diagnosed with neonatal pyoderma, which if we can see in the guideline or in the tabular, the answer is P39.4, which is neonatal skin infection under neonatal pyoderma.